Welcome back to Fox 8 News in the Morning. Coronavirus infections continue to surge across the nation. And with the school year quickly approaching, experts are fearing the virus could spread even faster. Our good friend, Dr. Amy Edwards, University Hospital, is joining us now with an update on the local impact of COVID-19. Doctor, good morning. Thank you so much for joining us this morning. Appreciate it.
Good morning.
All right, what's the situation here in Northeast Ohio? I understand Cleveland's having a hard time right now, but what about the Northeast Ohio area?
Well, a lot of Northeast Ohio is struggling. I mean, if you look at Lorain County, their numbers are going up because, we're all kind of in the same boat of a lot of people aren't doing what they need to do to keep these numbers under control.
So I would imagine that you're applauding the governor's decision to make the wearing of masks a mandate all throughout the Buckeye State.
I'm just annoyed it took them so long to do it. I would have done it weeks ago.
Mm-hmm. Well, talk about what's happening as far as this travel ban. That came as somewhat of a surprise yesterday when he announced it. Why do you think that's important?
I'm not sure I understand the travel bans at this point. In the early days, when some places were super low and some places were super high, it made a lot of sense. But honestly, there's virus circulating all over the state, all over the country. At this point, I almost wonder if travel bans are a little bit of political posturing to make it look like they're doing something.
Interesting.
Because I mean, everywhere has got tons of virus. I'm not sure it really matters.
I mean, is there a concern getting on an airplane? Should we still be concerned about traveling by air if, in fact, we're going anyplace?
Yes, we should be concerned about traveling at all because traveling takes you outside of your house and puts you around people that you would not normally be around. And the whole point of social distancing is to stay away from people and to limit the number of people that you come into contact with to limit the spread of coronavirus. So, I mean, I agree that people shouldn't be traveling, but specific bans here and there, specific types of travel, I mean, in my mind, they're all risky, but I also understand, for business purposes, some people still may need to travel.
Schools, just around the corner, a lot of people talking about how they should open, if they should open and all of that. What's your suggestion for schools here in Northeast Ohio?
I mean, the number one suggestion I have is to think outside the box. I have not yet heard any school district talk about trying to use alternative spaces. Can some of these classrooms be put in auditoriums? Can they be put in convention centers? That way they can be socially distanced more appropriately. Most school systems are not requiring masks. They're just encouraging them, which I think is a little bit silly because I think any child over the age of 2 or 3 can easily wear a mask. And so I think they just got to be a little bit stricter about how they do it. And I think it can happen, but a lot of that is on us. The less virus there is in circulation, the safer it is in schools. And so we have to take responsibility and do the right thing to lower our coronavirus numbers, which will then make our schools safe. One
final question real quickly after wrap now. I keep hearing about air conditioning units and fans spreading the virus. Agree or disagree?
It depends. So when the virus is low and very few people are infected, it can actually decrease your risk because if one person is sick, it could dilute it over a large air volume. But if there's a lot of people spewing virus into the air, then yeah, it can circulate it around more and actually increase your risk. So it's kind of a mixed bag, I would say.
All right, Dr. Amy Edwards, Rainbow Babies and Children's Hospital, our resident expert. Thank you very much. Appreciate it. Enjoy your day.
You're welcome.
All right, bye-bye.